So I'm going to hand it over to Arda, who's going to talk about the apps.
Thank you. Hi, everyone. Thanks for having me here. Great to be back. It's good to be back in a tie, but this makes it worth it. Okay, well, we talked about infrastructure so far. This is the part of the iceberg that's under the water that actually supports everything above. That's the foundation for everything looking forward. And it's really the patient-facing apps is where the rubber meets the road. That's where a real person gets real value in the real world around the clock. So there are three for anyone that hasn't seen this so far, unlikely. But there were three things that we wanted to start with. One, can you please help me gather all my records, wherever they may sit, as long as I can prove that I am, who I say I am, then allow me to, in my personal vault, gather all my records from all the specialists, partialists, as someone calls it, and so I can have a whole person, the big picture for myself. And then, if you may, can you please let me use that big picture for the next time I check into a doctor's visit? It could be a brick and mortar, so that's what Kill the Clipboard is about. It's a QR code or a tap, and with that, the whole picture is available so that you can base any conversation on that whole thing. But then again, most of the time, 99% of the time, we're not in the doctor's office. So that's the second and third category we talk about. What if I want to manage my metabolic health? That's the driver of so much of the pain and suffering and disease in our nation. So that is the obesity and diabetes management workflow. And then finally, and this was a little bit open-ended last time we talked about this, but what if I want to tie that big picture to a more generalized AI experience? And what if, to the extent that I'm comfortable with it, I can offer my full history, but then have this experience consider the latest research out there, all the pathways, all the interventions available to me, clinical or lifestyle, for then to help me with my next worry, next symptom, next aberrational lab results. So that's conversational AI. So with that, let's switch to all our folks that crossed the finish line for patient-facing apps. There are many that you've seen in the headlines that are working on things behind the scene that we're grateful for pushing the bar, raising the bar for all of us. But these are the folks that are in GA that have fulfilled the Medicare app library requirements. They have privacy and security review. They have the identity layer and patient matching verified. They have FHIR integration confirmed, and not as a demo just for a couple people, but in the real world for anyone who wants to pick it up from the app library. With all that said, okay, Andor Health, Be Well, Bearwise, See the Signs, Coligomed, Conxus, Siren Care, Doctronic, Fasten Health, Fidon Care, Flexpa, Flight Health, Frottercare, Google, Verily, Guava Health, How3, Habitnu, Health eServices, CVS Health, Health 100, HealthX, Health Tree Foundation, Humetrics, In Pursuit Health, January AI, Carawell AI, Medikarma, Microsoft AI, Empower Me, My Digi Records, My Med Access, My Benny AI, Primary Record, Noom, Patient-Centric Solutions, Patientory, Polygon Health, Samsung Health, Sabre Health, Seekster, Serene Care, ShareCare, Slotwise, SyncMD, Triangle Health, Wall Connector, WallDoc, Whoop, ZocDoc, ZPaper. Thank you all.